Carpal tunnel syndrome is a diagnosis that can be exacerbated by overuse activities. And we traditionally have related it to computer work and computer use, but it's not clear whether computer use itself is the primary cause. It can exacerbate. So computer use can exacerbate your symptoms, but it's difficult to say that it causes carpal tunnel syndrome. So what does cause carpal tunnel syndrome? We know that the cause is compression of the nerve, and many different reasons can exist for compression of the nerve across the wrist. Some of those are related to metabolic reasons, such as if you have rheumatoid arthritis, you can have carpal tunnel syndrome. If you have some other diseases, you can have carpal tunnel syndrome. If you're pregnant and you have increased amounts of fluids in your system, you can have carpal tunnel syndrome. If you break your wrist and the space in your wrist decreases, you can have carpal tunnel syndrome. So there are many different causes of carpal tunnel syndrome. So one needs to look at what the causes are and what to do about them. So if we talk about a pregnant person having carpal tunnel syndrome, no treatment really needs to be done for carpal tunnel that is caused by pregnancy, because once you have your child, the symptoms are going to go away. Same thing with trauma. If some sort of a trauma has caused carpal tunnel syndrome, then when you correct the trauma, when you have surgery for your wrist, or the wrist is fixed or wrist is reduced and put in place, then the carpal tunnel syndrome should get better. But there are times when the carpal tunnel syndrome needs to be treated with surgery. So there are various different treatments that we do for surgery for carpal tunnel, and that can start with just splinting at night, taking anti-inflammatories. Then you could talk about injections. And finally, if none of those treatments are working, then we can start talking about surgery. When surgery is indicated, then your physician will talk in detail about the risks and benefits of surgery. And so the surgery is done as an outpatient procedure. It's a same-day surgery. It's about a 1-hour procedure. You can go home the same day. It's a small incision in the palm, and various different surgeons will do it differently. Some make an incision in the palm, some making in the wrist, but it all entails releasing the pressure on top of the nerve. And so releasing the ligament, which is called the transverse carpal ligament, that is affecting and pushing on the nerve. The surgery is done with a small incision. You're encouraged to continue to move your hand and your wrist as much as you can to prevent scarring, and it's a same-day surgery. You're encouraged to keep the incision clean and dry until it heals. Usually that takes between 3 to 4 days. And then you do have stitches or sutures that are closing the skin that need to be removed in about 2 weeks. Some people who have immediate return of symptoms get right back to work, and others take a long time to return. There's a video of a doctor having carpal tunnel release, and it's a continuous video where they do the release, they suture him up, put a Band-Aid on it, and goes right across the hallway and starts seeing patients. So your return to work can be that fast, but most people take a few weeks before they return to work.